Hey guys, welcome to yet another video, and today we are going to be discussing about the surgical site infections. So this is a very interesting topic, and I will be using interesting tools such as mind maps to cover this topic. So I will try to make this as simple and easy as possible for you. So let's dive into it. And so according to Sebastian, what classifies as a surgical site infection? So this is an infection which is related to the operative procedure and it occurs within 30 days after the operative procedure, or it occurs within 1 year after the operative procedure, but there is an implant in place. So without an implant, it is within 30 days, and with the implant, 1 year is the time period. So that is surgical site infection. Now, moving on to the risk factors. So here is a mind map to explain the risk factors. So in the risk factors, as you can see here, we have patient factors, we have environmental factors, and we have treatment factors. So let me just zoom into this for you. So the patient factors, as you can see here, we have different factors such as alcoholism, ascites, age, chronic inflammation, diabetes, history of skin or soft tissue infection, hyperbilirubinemia greater than 1 mg per deciliter, hypercholesterolemia, hypoalbuminemia, immunosuppression, malignancies, malnutrition, obesity. This is a major factor which causes surgical site infection. PVD, postoperative anemia, pre-existing infection, recent radiotherapy, smoking and steroid therapy. So we have different studies which prove that these factors are risk factors for surgical site infection. For example, obesity. The BMI is an important consideration we take before doing a surgery on a patient. So, history of skin and soft tissue infection. Skin is analyzed for any of this. And I can give you examples. Diabetes, glycemic control. So, some surgeons they recommend that HbA1c that remains less than 8.5. So there is different preventive measures we do so that these risk factors do not lead to surgical site infections. So these are the patient factors. So remember that. If you've taken a snapshot of that in your brain, next is the environmental factors. So in the environmental factors, we have contamination, inadequate antisepsis, inadequate disinfection, inadequate ventilation, increased operating room traffic. All of these, I think it is like self-explanatory, right? Contamination, inadequate antisepsis, inadequate disinfection, inadequate ventilation of the OR, and increased operating room traffic. Next, we have the treatment factors. So in the treatment factors, what we do affects whether the patient gets a surgical site infection or not. So blood transfusion comes in that. Contamination again, poor scrubbing technique, a breach in the asepsis, poor gloving, etc. Usage of drains, emergency surgeries, high wound classification. If it is a dirty wound, there is more risk of getting a surgical site infection than if it is a clean wound. All right. So to understand more about this surgical wound classification, I've made a whole another video on it, and I want you to go and look at it to gain an insight into the surgical wound classification. So you should be doing this video preferably after that video. So high wound classification. Then we have hypothermia, hypoxemia. So for hypothermia, we have to maintain the OR temperature at a certain level. Then hypoxemia is another factor. And then inadequate or inappropriate antibiotic prophylaxis. We have to give antibiotic prophylaxis in case of contaminated wounds, dirty wounds, clean contaminated wounds. In clean wounds, we give it only if there is an implant in place. And poor glycemic control. So there has to be good glycemic control and if the operation is prolonged. So these are the treatment factors which are predisposing to create a surgical site infection in your patient. So we're done with the risk factors. We discussed the patient factors, the environmental factors, and treatment factors. Yeah, so now we are discussing about the classification of surgical site infections. So As you can see here in this mind map, yes, I have another mind map for you. So please subscribe, like, and share this video if you've liked it so far. And let's continue. Yeah. So superficial incisional surgical site infection. This, as you can just guess from the name, it involves only the skin and the subcutaneous tissue. Next is the deep incisional SSI, which involves the deep soft tissues. That is, it involves the facial layers and the muscle layers of the incision. Then we have the organ or the space. So this includes the infection. It is in any part of the body, excluding the skin incision, fascia or muscle layers that is opened or manipulated during the operative procedure. So this involves the organ or the space components. So I think that is simplified for you. Let's move on to the next topic. So now we're going to discuss the diagnosis, the treatment, and yeah. So I'm just zooming in onto this whiteboard that I made for you guys. So the diagnosis, it is done clinically. So surgical site infection, we diagnose it clinically, and you can diagnose it with the help of signs and symptoms that you see in your patient. So the signs and symptoms are the signs such as erythema, tenderness, edema, and warmth. But the patient complains, and that is the symptoms. I guess you know the difference between signs and symptoms. So if you don't know, signs is what the doctor observes, is what we observe as doctors, and symptoms are what the patient complains of. So the patient will complain of pain, redness, and swelling. Okay. And what we observe is erythema, redness, tenderness, pain, edema, swelling, and warmth. All right. So we see these things, and that is how we diagnose surgical site infection. Now, how do we treat a surgical site infection? So for treating a surgical site infection, we do pathogen identification. We have to identify the pathogen which is responsible for this. Source control by opening the incision in superficial or deep surgical site infections. Or if it is an organ space surgical site infection, you can do an image guided percutaneous drainage or laparoscopic or open drainage if indicated. All right. Then we can do an empiric antibiotic coverage. This has to be immediate. Then it is important timely antibiotic de-escalation. It is important to give antibiotics only for a certain period of time. This will help to prevent any resistance to antibiotics. So the antibiotic duration, dose, everything has to be controlled once the infection is identified. So next is local wound care. So that is all about the treatment strategies for surgical site infection.